Are you wondering why your hip pain may be affecting your low back pain? Has somebody told you that you have a problem with your psoas, but you're not quite sure where it is and what that means? Or maybe you feel like you overuse your psoas when you're doing abdominal exercises, including crunches or sit-ups or V-ups or anything like that. And you're wondering, why does that keep happening? Well, that's what we're going to talk about today. I'm Dr. Amy with Physical Therapy for Everybody, and this month's topic is, yes, there's a muscle there. It started because I had a patient who I was working with who had some bone pain, and when I was working on a muscle that was nearby, he was like, oh my gosh, that's my pain, but I thought my pain was the bone. And I said, well, it is technically the bone, but the muscle attaches into the bone. So when the muscle is tight and it pulls on the bone, it causes pain in the bone. But it's actually because of the muscle, right? So he was like, I didn't even know there was a muscle there. And I was like, yes, there's a muscle there. So that's what brings us to this topic this month is, yes, there's a muscle there. Now, a lot of people have heard about the psoas muscle and maybe have had some experience with it before, had it worked on before, but don't necessarily understand the intricacies and how connected it is with the low back and the abdominals. So that's what we're going to discuss today. All right, your psoas muscle is a hip flexor. A hip flexor is a muscle that brings your knee towards your chest. So you're using it when you're walking, you're using it definitely when you're running or jumping or squatting or anything like that. You're using your psoas pretty regularly throughout the day. It's a pretty important muscle. It transitions between the lumbar spine, which is the low back, and the hip. So it's one that you use a lot and it's pretty important. And if it gets tight, it can really become a big problem. That's because of where it starts and where it ends. So it starts on the front of the lumbar vertebrae. So you have 5 lumbar vertebrae that makes up your low back, and they have these things that stick out on the side. They're called transverse processes. The psoas muscle actually attaches onto the front of those transverse processes. So your psoas muscle actually originates or starts in your low back. And then it goes down through the front of your thigh and attaches onto that big thigh bone, your femur, right? Which makes sense if you think about it. If your low back is still and you bend your knee up towards your chest, yes, that makes sense that that's where the muscle would run. Now, the struggle is that if that muscle is tight and you are trying to stand up straight, well, it can cause you to bend forward a little bit and pull on those vertebrae. Now, if it's pulling the vertebrae forward, that's not a great thing, because if you're pulling forward, that means there's compression in the back. And the thing is with the lumbar vertebrae, actually with all vertebrae, is that in the back is all the nerves and the discs and everything that can get pinched. And that can cause a lot of problems with your low back pain. So it's a really critical muscle that people don't necessarily think about when it comes to low back pain. But if your psoas isn't moving right, it's going to keep pulling that lumbar spine forward, which is going to keep pinching everything in the back, which is why we often check not just your psoas strength, but your psoas length. Because if it's not long enough, it's going to be pulling. That's all there is to it. Now, more often than not, here in the clinic, I find that people have really strong psoas, but they're really tight. So when they try to lay down on their back and put their legs down straight, so they're just trying to be totally flat, they can't because of a really tight psoas. So that's something you can try at home. Can you lay down on your back, legs straight out, and just let everything relax? Your legs would be straight down. You would feel your thigh and your calf on the ground equally. Now you will still have a slight bend in your lumbar spine. That is normal when you're laying on your back. Not a huge bend, but a slight bend. That's called your lumbar lordosis. That's the curve that you have in your low back. And that is actually normal. A small one, not a big one, but a small one is normal. Now, what does the psoas have to do with the abdominals? Well, you see, obviously, if you're flexing the hip and you're attached to the lumbar spine, you could also help potentially to flex the trunk forward, right? Which of course that's the muscle, that's what the abdominals are supposed to do. That is their job, that they help to bring the spine forward or flex it forward. However, if we're not properly activating those abdominals and we're not really focused on those abdominals, the psoas will come in and say, oh yeah, I got you. I'm gonna help you out here. So this is really interesting. If you feel like, oh no, this is definitely not happening to me when I'm doing my sit-ups, I'm definitely using my abdominals, then I challenge you to try this. What I want you to do is when you're laying on the ground, doing your sit-ups with your knees bent up, I just want you to press your toes into the wall. You don't have to press hard, right? Just a light pressure is fine. What that does is it helps to activate the back muscles, the back of the hip muscles, so your glutes, right? It will help to activate those, which inhibits or decreases the activity of the psoas. And see if you can still do your sit-up as well. You might be shocked at your results with this. So I definitely guarantee it's something you should try, especially if you're having hip pain, if you're having low back pain, you don't understand where it's coming from, you do crunches, you feel like your abdominals are really, really strong, it's not going to hurt to test it, right? So just do your regular sit-up, but instead of having your feet flat on the ground, put them against the wall and gently press your toes into the wall. If you can do your sit-up the same, that means you're using your abdominals. But if you have more difficulty doing it, that means you're relying on your psoas while you're doing it. And that's going to be a problem for you in the long term, because although your psoas is going to get stronger, your abdominals are not going to get stronger. And it's important to have equal balance between the psoas and the abdominals. Well, really between all muscles. Because you see, the thing is if the psoas starts taking over, it gets stronger, which means it gets tighter. If it gets tighter, it starts pulling on that lumbar spine. If it starts pulling on that lumbar spine, that's going forward, which is compressing everything down in the back. Do you see how all these things are connected? It really gets complicated. And that's why when you come in here, we want to talk to you and hear your story and do a full evaluation, because it's not necessarily like, let's say you come in for low back pain and you even have an MRI and it shows that you have a disc problem. Well, okay, so that's where your pain is coming from. But the question is, why do you have that disc problem? Do you have a tight psoas that's pulling on everything? And until we get that released, nothing's going to heal properly. Or maybe you have a movement pattern that you do regularly throughout your day due to work or things that you do at home that's causing that disc to get compressed on. You see, MRIs can tell us what the pain generator is potentially, not always, but sometimes, but it doesn't necessarily tell us the why behind the pain. And that's really important, because when we know the why behind the pain generator, then we know the process that needs to be done to help everything heal. So I hope you guys have enjoyed this discussion about the psoas and why it's such an important muscle and how it's often misunderstood and kind of underplayed. Next week, we'll come back with another muscle to discuss. And until then, we hope you have a fantastic week. Bye, guys.